I'm Jonathan Yerasimides. I'm a board-certified orthopedic surgeon specializing in primary and revision hip replacement. I frequently get asked what's the benefit of anterior approach. Anterior approach has a world of benefits. The main benefits are quick recovery because we're dissecting in between muscle planes. We're not releasing muscle off the bone, which provides recovery time that's shorter. It provides a more stable hip, so we don't have to follow dislocation precautions like you would with a conventional total hip replacement or a posterior approach total hip replacement. It also provides me the ability to bring in X-ray during the operating room to assure that my implants are in the exact position I want them in, and also assure that my patient's leg lengths are exactly correct. So I think the main benefits, if I had to sum it all up, would be better control of leg length, better control of implant position, less dislocations, and faster recovery.